of the Starship Enterprise. Our 5-year mission to boldly go where no man has gone before. Yeah, it is. That's the old version. It's the version I remember. Very impressive digs. Staff, thank you all for what obviously is a great amount of work and labor to accommodate our meetings and the public's our meetings. So, great job.
Thank you. And when we get to full board, we'll recognize all the team members. They are behind that window right there, which you can't see them. We have no idea what they're doing in there.
Pay no attention to the man behind the curtain.
But it's great. It's wonderful. I would make sure that you members understand that you have a button and you can put it on and put it off. I am a little bit confused by this because if you have any tendencies to being colorblind, Dr. Weber, not suggesting that you and I do, but they tell me that part of this button is green and that means you're on, and part of the button is red and that means you're off. So for those of you who can see those colors, you will know when you're on the mic and off the mic. For those of us who don't, Dr. Weber, we'll have to help each other. And that'll be interesting, but we'll do our best.
I appear to be sabotaged because my light barely.
Really?
No, we're not gonna mess up anything.
Okay.
I'm just saying.
Well, and also,
I'll caution the audience.
and I'll mention this at our full board meeting, but being our first time, and this is the first live, we've had dress rehearsals, and the team has been fantastic, but we're going to go through a few steps and a few efforts here.
It's a much cleaner environment. It makes a lot of sense. Like you guys have done a great job. I'm informed of no citizens wishing to address item 3A, which is the approval of the minutes.
Second.
Much. That takes us to Mr. Rule, and consider approval of commercial lease agreement between Tarrant County Hospital District and the Fort Worth Trust. Welcome, Scott.
They do.
With buttons.
No, they don't, but we have a multitasking microphone on there which will pick up all 3, 4, or 5 people at
So
that
we can hear
table.
Dr. Johnson's.
We can. There's little pads that Scott is messing with, which he doesn't have to mess with. We got you covered.
That's right. My green light is on, so I'll start. Good morning. Of course, Diana's up here as well because I know that you'll all be interested in the services and the patients that will be served in this particular facility. We're here this morning to ask for approval to submit a lease agreement to the Finance Committee of a lease agreement between the Fort Worth Foundation and the district upon the approval of General Counsel. We all know that this is the location, a crucial location for our patients, right next to the Central Resource Facility. We're currently renting, subleasing space from MHMR to provide patient services. We would be renting about 12,737 square feet, which is about 25–30% of the total building. The other tenants, if you will, in this building will be other service agencies supporting the homeless population in Tarrant County. Diana, you want to talk a little bit about the services?
Sure. Now, before Diana goes into the services, let me tell you that this is the culmination of a good 10 to 12 years worth of work that was spearheaded by Mayor Mike Moncrief, Roy Brooks, and Betsy Price, and a lot of other people that have concern for the homeless population, and they have done wonderful work. We feel strongly at JPS that if you don't have health care as the cornerstone to help people who are in need and people who unfortunately have the challenges that you're going to see from a standpoint of, I don't know why that mic's doing that, but it'll come around. From a standpoint of the homeless population needing health care services, if you lose out on health care services, it's much more difficult to pick yourself up. It's much more difficult to go on a job. It's much more difficult to do the other things you need to do in life. Also considering the fact of how many women have infant children that are out in those settings, the care that we give in prenatal care, the care that we give to those pregnant moms and those moms as they go through the first stages of the life of their children is really critical. So this is more than just a lease. This is directly in line with JPS's mission, and there is a huge amount of hard work done by a lot of people on this project. But to our commissioner, our judge, our two mayors, and a lot of other people, I couldn't be more thankful, because this will make big differences in a lot of people's lives.
Yeah, certainly didn't want to understate. I don't think you can overstate the fact that this reflects a great deal of collaboration of agencies from across Tarrant County to hopefully provide services in this area.
We are very excited about the opening of this clinic. It's an absolutely beautiful facility. We will be doubling our capacity there for our homeless patient population. We'll have 6 exam rooms plus multidisciplinary rooms, oral health. We'll be providing imaging services on site. We've never done that before, so those patients will be able to stay at their clinic for those imaging services. We'll continue to provide lab. We've got a behavioral health day rehab program co-located there in that facility. Something really new that we have been talking about for a year is a medication dispensary for our patients. Very often when you're a homeless patient, keeping up with meds is one of the things that becomes very difficult. They get misplaced, lost, in some cases stolen. Our patients will be able to come back to our facility, and we will hold meds and dispense those meds daily for them, which we're very excited about. We'll have lactation consulting, group education, our outreach team, which goes out to the bridges and the hills. We'll have a place there where they can come in and connect back with the clinic. And we'll have clinical pharmacist support and navigation assistance for that patient population. So we will we generally see about 3,800 visits a year. We should be able to see about 9,000 in a year patient visits there as we open, and certainly we have the demand. That clinic will continue to be led by Dr. Frank Lonergan, who is a wonderful, wonderful asset to the Tarrant County Hospital District and to that community overall. We've added a second provider, Victoria Luivano. She joined us this past summer, and she is seeing those patients in 2 mid-levels who are part-time on the street, part-time in the clinic. So pretty excited. We anticipate adding wound care before the year is over. That's another very much needed service out there. We've hired a certified wound care nurse to serve that patient population at the clinic. So we are looking forward to being able to offer that comprehensive care there.
Any questions for Scott or Diane?
Yeah, Mr. Chairman, not a question, but I know Scott and Diane always said it's been collaboration of many agencies. But I think it just needs to be noted that JPS was the key agency that really got it going. Had we not been out there, I don't think it would have gotten off the ground as it did.
I think that's right. We had that announcement here at JPS to announce that collaboration. It was a pretty exciting time, and I think it marks a turning point for our care of our population and so many more that go beyond our patient care around here in Tarrant County. And I will tell you that I want to give a shout out to Scott on this, because not to in any way, dilute the importance of the social impact this has. This also was a business deal. And I want to appreciate the fact that Scott, I think, worked very, very hard on behalf of the district to make sure that we remain good stewards of the tax dollars that are placed in our care, to make certain that the lease was equitable, that the tenant improvement and finish of this was appropriate, and that is sometimes a difficult road to go down. And I know Scott spent a great deal of time doing that, and I want to give you a shout out, Scott, for a great job in working toward that end. All righty. Any other questions for the committee? If not, we need a motion on this? All right, we will take, we'll go to finance.
That's correct.
After us, and when do you expect?
Once we finalize the lease and in accordance with the general counsel.
Lease right now, Mr. Chairman, and should have that ready. We're hoping to have it ready to get feedback from the other side quickly, be on the next finance meeting. So, if it isn't, it'll be on the fall.
All right, so potentially the next finance committee meeting, and then ultimately as a recommendation to the board. So we need a motion recommending this to move forward with finance.
Move that we do the lease to the finance committee.
Motion by George, second by Ray. Any question or discussion? All in favor, say aye. Aye. All opposed, same sign. That motion carries. Scott, Diana, thank you very
Thank
much
you.
for all the work you've done on this. That will take us to, and I will tell you, we I forget it when you're finished.
Because that jacket may not stay on long, so we want to get his picture taken quickly.
Yeah, I want to get a picture. Yeah,
Uh-huh,
I want
yeah.
to get a picture of him in that tie quickly. I don't want to miss that opportunity, so if you all would.
There you go.
Do that. So, Angie, why don't you come on down and give us the update for the capital project? Welcome and Happy New Year to you.
Thank you. Happy New Year to y'all too, and thank you for letting me present. This is just an update, as Mr. Chairman said, of our capital construction projects. The first one listed for you is the Northeast Tarrant Medical Home. We are in design, filing up our design. It was approved by the City of Euless Planning and Zoning Committee on December 20th. It'll go before the City Council on January 24th. They approved the plat and the site plan. I would like to say that the City of Euless staff has been very kind and very helpful and easy to work with. It's really been a seamless process. We anticipate bid and award.
Good folks over at Euless.
There-
Good
yes,
folks
there
over
are.
at Euless. Just saying.
We anticipate bid and award February to April, and we'll be bringing a construction contract back for your approval in our project budget. Construction itself will be from May 17 through, we anticipate, through May 18. So that, about a year is what we think it's going to take to get that up. But we're on track, so we're excited about that. The second capital project is the ED expansion into the shell space. And you'll remember with our east expansion, we built out a shell space contiguous to the existing ED that we will be fitting with more rooms. We are hopeful to get 15 rooms in there. The architect was selected and approved at the last board meeting. What we're doing right now, we're ready for a kickoff meeting, but we thought it was wise to wait till the new ED director gets here on February 6th. So we'll have his input as well. So that is ready to go. Comments or questions on that one? Okay. The third one is the radiology equipment replacement project. And if you'll remember, you've already approved the architect. This is several pieces of radiology equipment, and it does require an architect, just structural, mechanical, any changes in the weight or the heat that that equipment puts off, we've got to accommodate that. And we'll also be getting a new MRI, so that'll be a build out for a new MRI, which will be good. Northeast Clinic cleanup. If you'll recall, we own 2 buildings that are vacant at Northeast, just directly across the street from our current clinic location. And we have cleaned those up. It's ongoing, a little odd and end things just to make safe and to clean up for potential sale. TSP Phase 3 patient rooms. That one is primarily, and I know this sounds odd, but it's primarily doors on the patient rooms and the patient bathrooms. And the whole TSP building, the doors need to be replaced just for a make safe. The last one is our main hospital. You'll see old OR. That's just to give you an idea of the location. We're putting the Trauma Advanced Practice Nurse program in that location. It's going to require some construction, and we're in design for that and ready to move forward on that one. Any questions? Sir? There is a piece of general x-ray equipment at the jail that JPS owns the equipment, and it's aged and it's old. So they're going to replace that piece of equipment. Now, keep in mind, we don't do any construction at the jail, but we'll have our staff out there to oversee it, and the if it's Siemens or GE, I'm not sure who they selected, their staff will be at the jail too, and you have to go through the whole background check and all that. So it's on there as a project because our folks will have to be out there.
What does it do? What's the radiology equipment that's out
The general x-ray, if you get a sprain or a broken bone and they have to x-ray you in the clinic, the jail clinic, that's what it's for. Any more questions?
Angie, I'm assuming that you will be at the U.S. Council meeting on January 20th?
Yes, sir, with bells on.
Do you anticipate needing any of us to be at that meeting?
I don't. Diana Prachel was kind enough to come with us to the planning and zoning, and we were there in force with our architects, and they were more than kind. So no problems at all.
Well, it's an important day for us, and I'm assuming that it will go through without hitch at all. Any board member that would like to attend just to show their support for this project and the effort that's gone into it, I'm sure would be acknowledged by the city of Euless because they see this as a real benefit to their community as well. The JPS, so we
Yes, they do.
all would like to be at that meeting, on January 24th.
Okay.
And with that, I'm informed by council that there is no need for an executive session today. So
Thank you.
absent anything else that you might have, we will consider this meeting. Places to go and get our pictures made. Thank you all for being here.